Vaginal tightening has become a very common procedure with celebrities in Nairobi. The reason for its rise is after childbirth, you have laxity in the vaginal walls, and with the laxity of the vaginal walls, during intercourse, they are not able to um, uh, have the same kind of sexual intercourse that they used to have before they gave birth. So, for this reason, they come in and we have the CO2 laser, the pixel laser, and with this, we do something called the Femilift. And then there's a new treatment called Mcella, where you sit on a chair and you sit on a chair and it sends these contractions to the pelvic floor muscles that cause tightening of the vaginal walls.
Hello and welcome. My name is Kalandu Musimi. When you see me, it's an exclusive interview about to go down. And seated next to me is Nairobi's celebrity dermatologist. Please give it up for Dr. Pancholi. Hi, how are you doing?
Good, I'm great. Thank you. How are you?
I'm fantastic. Thank you so much for inviting us to your place.
You're welcome.
It's pronounced as Avane.
Yes, Avane.
Avane. What do you offer at Avane?
So, Avane is a cosmetic dermatology clinic that specializes in non-surgical cosmetic procedures. This includes non-surgical weight loss, Botox, dermal fillers, breast lifting, butt lifts, skin tightening, vaginal tightening, amongst other interesting things. So yes, there's a lot of interesting things that we do, and we can delve into those in a minute.
Yes, and I must say that is very interesting. First of all, I'd like to know about the non-surgical weight loss procedures. Is it what do you guys offer?
So the non-surgical weight loss procedure that we offer is the Allurion gastric balloon for weight loss. And we also have the Slender Wonder program, but by far the most popular one is the magic tablet that you swallow that becomes a balloon in your stomach and then comes out from behind after 4 months, and you have lost up to 15% of your body weight on average.
How does that work? It's a pill you swallow, it becomes a balloon, or do you just, from a layman's term, do you just swallow a balloon? What does it entail?
So I'm just going to show you what it does because that's the easiest way of explaining it. Okay, so it is as simple as this, and I'm sure you've seen Jackie's videos. And basically, this is the tablet. Okay, you swallow this tablet, and then the tablet comes into the tummy, and then when it is in the tummy, we fill it with some saline. It becomes a balloon like this in your stomach. Okay, and then once you have the balloon, it stays for 4 months and reduces the space for the food, which means you eat less, and then when you put on the correct weight loss and diet, then you're going to lose substantial body weight. Now, what is different for this is the fact that this is linked to a smartwatch and the scale. So when it is linked to the smartwatch and the scale, then in real time, I can know what is happening on your body, how much weight you have lost, how you've slept, what your heart rate is. So we are able to monitor in real time what is happening with the patient. So even if I get a call in the middle of the night and they say that, oh, Daktari, I'm feeling a little bit of cramps, I go to the computer, I check, and I tell them, okay, take an anti-cramp medicine, everything is fine, don't worry, which is not available with any other kind of gastric balloon.
So is how big, can I touch it?
Yes, of course.
This is how big the balloon is inside the stomach.
Absolutely. So this is, it may look big, but this is 550 ml, which is like a can of Tusker or a bottle of Tusker.
Yeah. All right. Well, what are some of the things you need to do before the procedure is done?
This is a patient, and through the Allurion portal, what we are able to see is the starting weight of the patient, the current weight, the total weight loss, the starting BMI, current BMI, how long they've been in the program. We're looking at the scale data, and we're seeing she was at 105, and then by October she had reached 99. Then we look at the BMI, we look at the body fat, we look at the muscle mass, we look at the bone mass, the body water content. So the water content has increased and the weight has been lost, which shows that this is actual weight loss. Then the BMR is the basal metabolic rate. So even the metabolism has reduced, and the visceral fat has still remained the same. So this means that the good fat around the intestines and all of that hasn't really changed. Yeah. So by going through all of this and looking at the activities, we can monitor the heart rate, how the person has slept, everything. So looking at all of this, looking at the heart rate, looking at the sleep patterns, and just being able to monitor is the new era of weight loss that has dawned upon us.
And why do you think, because you've mentioned you've worked with Jackie Matubia, and she has also mentioned it on her YouTube channel, why do you think this is a trend right now for many patients and also celebrities as well?
So weight loss in general is a difficult journey. Yeah, people put on weight, and this weight may be related to stress, which is a big factor in our modern day world. Poor eating habits, dieting is not possible. You're eating at restaurants all the time, you have business meetings, and you just have a very hectic life. Sometimes after pregnancy, there's just too much weight that you've put on. And like, for example, with Jackie Matubia, she needs to lose weight as soon as possible, get to her pre-baby weight. So she needs to have a solution that is fast, rapid, and effective. And I mean, in today's modern day world, everybody's looking for a quick solution. Nobody wants to wait and, oh, I'm going to go to the gym, I'll go there for 2 years, I'll be consistent with my diet, this, that. I mean, yes, of course, you can do that if you have the willpower, and it's a natural weight loss is also a very good way of doing it. But for people who have a very active professional lifestyle that may not be able to control their weight through diet and exercise, then there's a new option available in the market, which is quick, easy, and effective.
How long does the balloon stay in your stomach?
So the balloon stays in your stomach for 4 months, and after 4 months, it is ejected from the back. It bursts and it comes out from behind. So the beauty about this procedure is that there is no surgery, there is no endoscopy, and there is no anesthesia. Yeah, so you need to make sure, you need to be careful, because there are other companies that are saying that we do the same thing as Allurion, but they are not doing the same thing as Allurion. Some people put endoscopic balloons, some people do surgery. So there are a whole myriad of weight loss surgeries that are available in the market. You need to make sure that when they do the endoscopy, then they're not just putting it in the stomach, and then after a few months you're told, now you need to do another endoscopic surgery to remove the balloon. So these are things that sometimes people are not told when they're putting the balloon in. But with the Allurion program, you actually swallow the balloon and then it comes out from behind after 4 months automatically. There's even a warranty in place. So if the balloon does not stay for 90 days, for whatever reason it ruptures, then through the Allurion program, we put in a balloon for you free of charge. Also, if there are any complications during the procedure that are balloon related, then Allurion, a Boston-based company, covers you for any complications that arise from it.
You've mentioned a lot about good things about it, yes. But what are the side effects as well?
So any medical procedure has risks and side effects. Even from a simple surgery, people have not woken up. So with any surgery or with any kind of anesthesia, there is always a risk of somebody not waking up from it. So the Allurion balloon in this case is a program that has the least side effects, and the main side effects are nausea, vomiting, abdominal cramps, and esophageal reflux. Apart from this, there is a 0.02% chance of gastric outlet obstruction, which means that the balloon may block the GIT system at the stomach area if it lodges badly. Now, there are 100,000 balloons that have been placed, and the risk of gastric outlet obstruction is 0.02%, which means that out of the 100,000 balloons, only 20 have had gastric outlet obstruction. And in this case, when you get gastric outlet obstruction, then endoscopy is required, where we put a pipe down, we rupture the balloon and we pull it out, and it's a 25 to 30 minute procedure that has to be done in the hospital. Apart from that, the gastric balloon is an outpatient procedure. It takes less than 15 minutes. You swallow the balloon, we take an X-ray, we fill it up, and we're good to go.
How much does it cost?
So the gastric balloon is 500,000.
Kenya shillings, right?
Yes.
At what age should I get the procedure done?
Okay. So you can, anybody above the age of 18 can get it done. If you're getting it done at a younger age, then you require parental consent, and we would have to speak to Allurion, because what we do is we work with the company hand in hand. So even the data that we give, they look at it and they advise us. So if somebody's losing their weight loss cycle, then we even get alerts to say that the patient has taken the balloon, but there is something that they're not following, so dropping off the weight loss cycle.
You know, apart from Jackie Matubia, who else have you worked with? Because I've seen on the wall, you've worked with Kim Kardashian's doctor as well. So who are some of the people that you've worked with as well?
Okay, so as a celebrity dermatologist, I work with a lot of celebrities in Kenya and within East Africa. Sometimes we even get people coming from Dubai. The gastric balloon, we had somebody coming in from America to do it. She was an old patient of mine, and she was passing by Kenya, and she said, "Daktari, I'd prefer to do the balloon with you rather than doing it in America." So she got it done here. But I have a wall outside there and you can have a look. I'm bound by doctor-patient confidentiality, so I'm not able to reveal anybody that I have worked with.
Unless they talk about it, right?
Yes. If they talk about it, that is okay. But I'm not allowed to speak about my patients.
Because I'm also wondering, because you've mentioned this is what we are swallowing. So I'm wondering, is it painful? Because I have to swallow, all this goes into my stomach, right?
So you see, it's just a little bit of discomfort when you swallow. Yeah. So sometimes you can get the gag reflex, but so it just may feel like you want to throw up when it tickles the back of the throat like anything else. But when done correctly, it just goes in so smoothly without any issues.
Daktari, when the balloon bursts, where does the water go?
So it is a saline-like substance, and what happens is it gets absorbed into our body and we remove it through the kidneys.
What?
Yeah.
People would say we are overworking in the kidney.
It is 500 ml.
Yeah.
It is like a beer bottle.
Yeah.
So we are not overworking when we drink 10 beers, are we?
Well.
Exactly. So, no, basically what I'm trying to say is that 500 ml is not really going to affect the kidneys.
For a layman right out there, what is Botox?
So Botox is basically an injection that is used to smooth out wrinkles. Botox and dermal fillers. So these are the anti-aging procedures that we do, because after 25, you actually start to see signs of aging in the skin.
And I've seen a lot of people say they just want the smiling lines to go away or stuff like that. Do you get such issues?
Of course, we treat over 10 to 15 patients with cosmetic concerns every day. Yeah.
With Botox, you can inject anywhere?
You can't inject Botox anywhere. It has to be done professionally. There are certain areas. You have to have a special training for that. And then, depending on the indications, understanding what are the risks, what are the benefits, and then after that, the patient makes an informed decision, and then we can inject.
And of course, Doctor, you mentioned about, I don't know, is it breast lifting, butt lifting, but non-surgical? How does that even happen?
Yeah. So for the butt lift, we have the non-surgical BBL, which is Kim Kardashian's favorite treatment. It's called M-Sculpt. So the M-Sculpt, and we are the only clinic in East, Central, and Southern Africa to have the M-Sculpt machine. It is a machine that produces muscle contractions that is similar to 20,000 muscles squats in half an hour. And what this does is it causes firming and tightening and lifting of the bottoms. For the breasts, we can't obviously deal with large pendulous breasts, and what I would recommend is for that you would do plastic surgery. So when people have lost a little bit of tightness of the breasts and they're just starting to sag and all of that, then by using radio frequency we are able to firm, lift, absorb, and tighten.
Daktari, also you do vaginal tightening as well. Talk to us about that.
Vaginal tightening has become a very common procedure with celebrities in Nairobi. The reason for its rise is after childbirth, you have laxity in the vaginal walls, and with the laxity of the vaginal walls, during intercourse, they are not able to have the same kind of sexual intercourse that they used to have before they gave birth. So for this reason, they come in and we have the CO2 laser, the pixel laser, and with this we do something called the FemiLift. And then there's a new treatment called Mcella, where you sit on a chair and you sit on a chair and it sends these contractions to the pelvic floor muscles that cause tightening of the vaginal walls.
Also, acne and stretch marks. There are many I've seen many hacks on Google, how you can, apply what and what. How do you go about that, acne and stretch marks?
Okay, so the thing is that I treat over 200 conditions, ranging from unproportional lips to acne to stretch marks to non-surgical nose jobs to lifting the eyes, chin filler, cheek volumizing, neck treatments, making the lips smaller, changing the color of the lips if some people have darker lips. We do skin lightening that is safe, breast lifting, butt lifts, microneedling, acne scars, pigmentation problems, nail fungus. So there's so many things that we do, and we cater for the celebrities in Kenya and around.
And also for the skin lightening, there's a lot of celebrities as well that have ventured into that as well. Do you receive a lot of those?
Of course, we do at least 2 skin lightening procedures a day.
What is that procedure that is very you do a lot because people want that a lot?
So Botox, facial contouring, dermal fillers, skin lifting, the glow facial. So there's a few things that we do that are really, really popular.
Right. Well, Daktari, I guess that's it. Asante sana. Anything you'd like to add as well?
So I'd just like to inform the public that there are places that are not correctly regulated. So do your research. There are a lot of places in Nairobi that are not regulated, and in some cases promote false information. Like somebody may tell you, yes, I do the Allurion balloon, or yes, I do the hydrofacial procedure, or yes, I do the cool sculpting procedure. But when you actually look and you tell them, show me the name Allurion, you will not see the name Allurion anywhere. You tell them, show me the name hydrofacial, you will not see the name hydrofacial on their machines. So this means that they are using trademarks inappropriately for professional gain. So be very wary of people like this, because there is a lot of funny business happening in Nairobi, and I appeal to the authorities to help with the crackdown.
By the way, for skin lightening, do you just do once or you come regularly?
So it depends on the tone you want to achieve, but you do need to do a few treatments.
Asante sana daktari, I really appreciate.
Thank you. You're welcome. It was fun.
Alright. Thank you so much guys for watching. Kama kawaida, my name is Kalondu Musimi. Behind the camera is Saidi Abdallah and Cheryl.